Welcome to the Voices for Change virtual tour. My name is Tracy Schott. I am a filmmaker and a social worker, and I created Voices for Change to create a platform for victims and survivors of intimate partner violence and the professionals and researchers who support them to share their wisdom. We started the virtual tour this year to partner with organizations around the United States to present on various topics related to intimate partner violence. Today, we are stepping out of that model a little bit to bring a global perspective to what's been happening worldwide with regards to gender-based violence. This virtual tour is coming to you from Pennsylvania, California, Great Britain, and Mumbai, India. We are taking full advantage of our ability to be virtual all around the world. Today, we are joined by Dr. Nandita Gandhi, founder and director of Akshara, based in Mumbai, India, a women and youth resource center working to end gender-based violence. Dr. Manisha Shah, professor of public policy at the UCLA Luskin School of Public Affairs and founder and lead director of the Global Lab for Research and Action. Joanna Shepard is the policy and advocacy lead on protection from violence at Plan International, which is based in London and works across 52 countries in Latin America, Asia, Africa, and the Middle East to advance children's rights and equality for girls. Paul Singh, co-founder and CEO of OneGen, an organization that uses digital technology to inspire stories of hope with the goal of transforming the world in one generation. They are also my partners in Voices for Change. You can learn more about all of our panelists on our website, voicesforchange.net. In April 2020, as countries around the world enforced lockdowns to address the spread of the COVID-19 virus, UN Women and the World Health Organization coined the term shadow pandemic to refer to the other global health crisis, intimate partner violence. These organizations and thousands of others recognized gender-based violence as an epidemic long before we became aware of the COVID-19 pandemic. 1 in 3 women worldwide are victims of gender-based violence. Additionally, 50,000 women and girls are killed by intimate partners or family members each year. We have another global health crisis that unfortunately has not been adequately understood or addressed by most people. The COVID-19 pandemic has only increased the dangers of gender-based violence. With victims isolated and forced into lockdowns with their abusers, domestic violence researchers and victim advocates worldwide sounded the alarm that this pandemic would inevitably lead to both increased rates and severity of intimate partner violence, as well as an increase in domestic violence homicides. Today, we're going to examine the research and learn how organizations and governments have responded. So let's get started. I want to start by asking everybody to give us a little bit of an overview of your work. And I would like to start with Dr. Shah. Tell us about your research and the development of the Global Lab for Research and Action and the goals for the Institute.
Thank you so much, Tracy. It's great to be here today. So as Tracy mentioned, my name is Manisha Shah, and I'm a professor in the Department of Public Policy at UCLA. I'm also an economist by training, and I direct the Global Lab for Research in Action, which we started at UCLA a little over 2 years ago. So our work at the lab focuses on the themes of health, education, and economic empowerment for low-income women, children, and adolescents. We also work and research hard-to-reach populations like sex workers, survivors of intimate partner violence. We research understudied issues like femicide, and the fact that these populations are understudied also means there's limited research to help inform programs and as well as policies. And so what do we do at the lab? First of all, we do the research. We do rigorous research. We evaluate programs. We evaluate policies. We analyze data. We're sometimes out there, leading randomized controlled trials to evaluate programs or policies. We work with a lot of government offices. We work with a lot of community-based organizations. We analyze administrative data coming out of government offices. And the idea with the research we do is the global labs, main focus is to transform this research into action. And so worldwide, we study issues like gender-based violence and sexual health, and then we translate and amplify the findings in order to improve programs and inform policy and hopefully shift the public conversation around evidence-based research. We use innovative ways of amplifying our findings. We're often out there publishing easy to digest policy and research briefs. We're publishing op-eds in mainstream media. Most recently, we've also been working with documentary filmmakers to get our research out. And the sort of goal or why we started the Global Lab was because research often doesn't make it out of the university and into the hands of people who need it, right? People who are actually on the ground implementing programs, people who are implementing policies. And so our goal is really that we need to be intentional. We need to be strategic about getting the research to the right people so that policies are evidence informed. And as an academic working at a university, we often don't have the incentives to get the research out. So the Global Lab really fills that kind of missing gap. Since we're global in our reach, we can learn from different programs. We learn from different policies around the world. And all of our work, that we're going to talk about today, but all of our work more generally really depends on partnerships. And one of our current goals right now is expanding our partnerships so that we're able to undertake more research, as well as further translate and amplify our findings to get them into the hands of individuals who need them. So thank you so much for inviting me to participate today, and I'm looking forward to sharing some of our research with all of you.
Thank you so much, Dr. Shaw. You're speaking my language when you talk about taking the research and putting it in the hands of people who need it. One of the things I discovered when I was creating my documentary film, Finding Jen's Voice, is that there was so much understood and known by a really small group of people. And my goal in all the work I do is just to try and get that out there, because I feel like the awareness is the first step to change. So thank you for the work that you're doing. Joanna, let's talk a little bit about Plan International. This is a really old organization. It's been around for a long time. Tell us a little bit about the history and some of the work that you've been focusing on in the last 5 to 10 years.
Great. Thank you so much, Tracy. And it's fantastic to be here with you all today. Plan International is an international NGO with headquarters based in the UK, where I'm based. And we work to advance children's rights and gender equality, specifically working with and for adolescent girls and engaging men and boys and families and communities to really address the root causes of gender inequality and gender-based violence and promote gender equality to ensure sustainable and lasting change. And so, as Tracy mentioned, we are active in a number of countries, and this is a map to show where across all 4 regions that we work in. So in the orange, we have our program countries where we undertake programmatic work. In the blue is our donor countries, and yellow in Colombia and India are our program and donor countries. And so this is a visual that is useful for thinking through the approach that Plan takes to our work, particularly with regards to our work with and for adolescent girls. We find it very important to take a holistic and life course approach to the work that we do to ensure that we are identifying the full range of barriers that girls experience from birth to when they become young women, specifically related to barriers that they experience because of their gender and their age, and obviously diversity factors too. And these include things such as girls' right to live free from violence and to be free from harmful practices like child marriage and FGM. And I'll tell you a little bit more about our work on that later. But it also includes things around access to education, quality education, ensuring that girls are able to make decisions about their sexual health and rights, that they're able to be equally paid and economically independent, and that they are able to have equal power and become active citizens and be involved and meaningfully heard in decisions that affect them. And underpinning all of our work on this is our work with girls and families who are affected by crises and humanitarian settings, which obviously makes them more vulnerable to many of these risk factors. And the reason that Plan uses this kind of approach is because we know that particularly during adolescence, so many of these issues are so interlinked for girls, and very rarely do girls themselves see one of these issues as a standalone. They often speak about 3 or 4 of these issues as being very interconnected, and so we know that we can't achieve gender equality and eliminate gender-based violence against women and girls until we are able to address all of these issues. And so just to quickly run through some of the key things that Plan has been doing during the COVID pandemic to respond to increased rates of gender-based violence across our 4 regions that we work in. We've been working to improve awareness of GBV reporting routes and support for survivors, such as psychological care. And this has included supporting remote reporting routes for GBV, developing online platforms for girls to report these issues, as well as working with partner organizations such as Child Helplines International to ensure that children, particularly girls, have a safe route for reporting and as well as being able to receive psychosocial care. We deliver a number of programs, including Parenting a Life Skills programs, which promote self-confidence and positive gender norms. And we've made significant efforts to ensure these are adapted for the COVID pandemic so that they continue during lockdown and that families, communities, and girls and boys can still engage. A lot of our programs tackle negative gender norms, toxic masculinity, and the culture of silence around GBV, working specifically to have an intergenerational dialogue with girls and boys and their families, as well as the broader community, to, again, ensure that the change that we are leading with and for girls is lasting and sustainable. We work to ensure girls access to education, which we know is a key factor in ensuring that they marry later, that they are able to choose when and if they get pregnant, that they are able to engage in decent work, and a lot of other important outcomes. And lastly, we've been undertaking research and needs assessments to understand the scale of the issue. We know that GBV, as Tracy mentioned during COVID, has significantly increased across the world, and Plan has been doing a lot of work, again, with girls and with data collection as well to understand just how girls and young women are experiencing that and what we can do, as well as what policymakers can do to help. Thank you.
I love Plan International's focus on girls. So much of what we need to do needs to be focused on prevention, and you have to start with girls and boys. And so I really do love the focus of your organization. And I'm so impressed by the work, and the longevity of your organization is amazing. Let's talk to Dr. Gandhi. Tell us about Akshara, and you're a co-founder. What have you been doing in the past, and kind of what are some of the shifts that you've had to make in the last year?
So as she has mentioned, I belong to a women's organization called Akshara and based in Mumbai, India. I also belong to the Indian women's movement, which around the 1980s took up the mantle of the earlier women's movement. And we had our first protests and rallies around the 80s on violence against women. I was part of that wave, and Akshara is one of the offshoots of the women's movement in Mumbai. We decided to work with young people and the prevention of violence on women through our gender awareness programs. So what you see on the screen is, of course, our first objective, that is working with young women and men. We empower them, these young men and women who come from socially, economically disadvantaged families. so that they can break out of the cycle of poverty by enhancing their own capabilities through formal education, livelihoods, and challenging deep-rooted gender inequalities. We believe that men must be allies in this struggle by changing themselves as well as society, understanding patriarchy and their male privileges and norms of masculinity, and as well taking actions. The other one is that focusing on youth and getting them to change towards gender equality will not be sufficient. We will need also to change institutions. And therefore, you can see two posters of our public campaigns. And we try to impact the gender understanding of societal institutions like the media or the education system. What is shown here is one of the campaigns which we had with the Indian film industry to make the songwriters and the consumers, that is the young people, aware of these sexist lyrics. We had a competition called Gana Rewrite, or writing the sexist lyrics. And we had hundreds of students and activists send us new songs based on popular music. It was tremendously successful. And the next one, the next strategic objective, that we might want to change the world. But we are aware that as a voluntary organization, our reach is limited. So we seek collaborations with the state departments to bring gender concerns within their vast apparatus. It is a way to reach to thousands of people. It also underlines the constitutional duty of the state to protect women from violence. Now, a few years ago, we persuaded the police to set up the first emergency helpline for women in Thane and in Mumbai. We've showed over there some posters. You can also see that next to it, there is a photograph of the police headquarters and women manning it. We train the women personnel to handle calls, and it receives around 400 calls a day in the city of Mumbai. The other is the right to mobility. Now, we know that there is something called street sexual harassment, and that thousands of women commuters especially are victims of it. So we decided to train about 80% of the personnel of the transport system, that is the public buses and the train systems, and advertise helpline numbers to help women commuters. The last picture is a very folksy sort of painting of the main railway station called the VT, which is usually used to symbolize Mumbai. Now, the city municipality is drafting the Mumbai development plan that is meant for the next 20 years, land use and all that. Akshara, along with other women's groups, introduced an entire chapter on women, which is the first in the country. And after 5 years of advocacy, we will be having multi-purpose women's centers across all the wards in the cities now. So that's Akshara and some of its programs in a nutshell. We're a small organization with national links and international connections to feminist groups in the global south.
My name is Paul Singh, and I'm a co-founder and CEO of a tech startup called OneGen. So about 3 years ago, we decided to use our engineering and technology background and the experience that we have gained working on large complex systems in the corporate world and apply it in social impact space. And with a very hefty ambition to transform the world in one generation, hence OneGen. We sort of wanted to have this bold and hairy goal because we believe in two very fundamental things. We believe in the power of technology, and we also believe in the power of effective storytelling. And we just intentionally chose the United Nations Charter for 2030, the SDG, 17 SDGs, Sustainable Development Goals. And we said, either some of these areas are underserved from a digital technology application perspective, or wherever we saw how the evolving field of digital technology, cloud computing, mobile, artificial intelligence, machine learning, it was just not at pace with how those applications were actually being applied, on these contexts. So we saw, well, that's a gap that we want to fill in. So I'm trained as an engineer. Most of my career has been in system development, and so we try to apply the system theory onto these complex problems as well. And one of the collaboration is Voices4Change with Tracy Shaw. And we wanted to take this great idea about raising awareness on this important topic and about these statistics, and sort of try to put stories on top of the data. And so the outcome was a digital platform called Voices4Change. It has a web and mobile interface with a lot of features and capabilities to build an online community forum. And our intention is to bring together voices of the survivors, give a platform where survivors of intimate partner violence experience could actually tell their story. And we want to create a discussion around it, because we believe that a first step towards solving anything is raising awareness. People should know about it. So there should be a discussion and dialogue around it. And that's one way we could apply a solution to the problem. And so everything we do at OneGen is leveraging technology as a lever and try to create stories of hope. So at OneGen, we believe that every small act of compassion, however small, has the power of creating the butterfly effect. So that's what we try to do every day using the digital technology.
Ironically, we released Voices4Change, the platform, on March 1st of 2020, and released it with a discussion about the pandemic of intimate partner violence. And then, of course, within 2 weeks, the whole world was shutting down. So it forced us to kind of take a second look at how we were planning to roll this out, what the content needed to be, and what we could accomplish. And like many organizations, we've done a lot of pivoting over the last year. And so I'd like to hear about some of the research and some of the things that you all have learned through your work on the ground in the last year in terms of how this awful COVID-19 pandemic has just made things so much worse for survivors of domestic violence. So let's start, Dr. Shaw, with your research.
So the first point I want to make here is that the sort of first thing to highlight is this is actually data from 2010, and it's a global heat map where the darker blue means more intimate partner violence. But the map that we generated here was generated by the lab using data from 2010 to show that IPV1 is a truly global problem. You'll see that rates of IPV range anywhere from kind of the low end, which is 20 to 30%, to the kind of, it can get as high as over 60%. So this isn't a rich country problem. This isn't a poor country problem. This truly is a global problem. And it was happening even before, the COVID-19 health crisis. Then we get COVID-19, we end up in our world of COVID-19, and we started hearing things like about the global shadow pandemic. And just to remind all of you, the shadow pandemic is a term that was coined by the United Nations to highlight the increase in violence against women and girls that we started hearing about amidst COVID-19 and the lockdowns. And so, while we were already working on these topics at the Global Lab, we decided to pivot and really try to understand what was happening in various countries and get at measurement, look at the data. And what I'm going to show you today is some of our findings very quickly. So what this figure or this slide is, it's basically Google search data, global Google search data for the term domestic violence hotline, starting in January 2014, well before the pandemic, and ending in kind of March, April 2020, which is the onset of the pandemic. And what you'll notice here is that the search for domestic violence hotline is at its highest at the onset of the pandemic, March, April 2020, as lockdowns are starting. This is a slide of data from India. And so this is, these are domestic violence complaints received by the National Commission for Women from October 2019 to February 2021. And the reason there are 3 different lines is we've separated the districts in India by kind of intensity of initial lockdown. So these red zone districts were the districts that had the kind of most strict lockdown in March, April, May 2020. And what you'll see here is that domestic violence complaints really shoot up during the period of the pandemic. And they don't really start coming down until July, August 2020. But the thing to note here is even though they come down a little, even until February 2021, we're still at much higher levels of domestic violence complaints in these districts that had the strictest lockdown. And we're still nowhere near pre-pandemic levels of domestic violence complaints in India. This is the same data set. We looked at various, outcomes related to violence against women. And here what you'll see, so this is very interesting. These are rape and sexual assault complaints also received by the National Commission for Women. And I think the interesting thing to note here is during this period of strict lockdown in these red zone districts, you actually see decreases in rape and sexual assault complaints. And this is probably related to, what Dr. Gandhi mentioned in that, in some of the things like sexual assault and sexual harassment tend to happen more when women leave their homes, when they're, riding buses or they're out on the streets. And so you'll see that lockdown was actually protective for some of these measures of violence against women. Unfortunately, though, you'll note that by February 2021, we're basically back to pre-pandemic levels of rape and sexual assault complaints. So it does seem, as women start leaving their homes, most likely the numbers kind of shoot back up to initial levels. So another area where we have very little evidence is this issue of how COVID-19 has impacted adolescent exposure to violence across the globe. And so the research here I want to tell you a little about is a research collaboration with Sarah Baird of George Washington University. And it builds on work that she's been doing with the GAGE project, which stands for the Gender and Adolescence Global Evidence Study. And so what we're able to do here is we use a unique longitudinal data set on close to 10,000 adolescents in these 3 countries. We have data that was collected pre-COVID. And then we were able to secure some funding from the Gates Foundation to actually follow these adolescents once at the onset of COVID. And then we have another round of data that we collect 1 year into the pandemic. And so what do we find? We find, the sort of main headline finding is violence is pervasive for both boys as well as adolescent girls. And so, 20% of our adolescent boys and girls are reporting an increase in violence against gender since COVID-19 started. And so why might we be observing some of these increases in violence? This is an area that we're thinking hard about. And I think, one of the big issues globally is that there have been large increases in economic security. And so what this figure shows you is that, anywhere between 60 to 80% of households across these 3 countries lost employment. The second bar shows you anywhere between 80 to close to 100% of households report losing some income. There's also, huge increases in households being unable to buy essential food items in the last week. There's also large increases in household stress happening, right? So, again, across these 3 countries, between 70 to 96% of households report that stress has increased. There's more arguing, there's more getting angry, a lot more stress in the household due to the pandemic. And then the last thing I want to highlight is there have just been large increases in social isolation. And so this is data from, from our adolescents showing that adolescents across the globe are reporting higher social isolation. And what's really interesting about this figure, though, is that the rates of female adolescents reporting social isolation are much higher than males. And so girls are really, basically have been stuck at home a lot during this pandemic, which of course increases their exposure to any violence going on within the household. And so, in terms of like what we're doing next and what I think some of the other individuals on this webinar will talk about is, what can we do now that we have good measurement of some of these issues? What can we do in terms of programs, policies? What is the role of social protection programs in ameliorating these increases in violence that we've been observing globally? Thank you.
Thank you, Dr. Shah, for the work that you're doing. It's incredible. It's devastating. It's not unexpected for anybody who's been working in this space for any length of time. The pandemic certainly has provided the perfect storm for seeing domestic violence rates shoot up. So I'd like to talk a little bit about some of what you've learned, Joanna, at Plan around, some of the reports that you're hearing from the country. You basically have boots on the ground in 52 countries around the world, and they've provided you with some anecdotal evidence as well. So I was wondering if you'd like to share some of that information.
Great. Thank you, Tracy. And yeah, I think this follows on very nicely from Dr. Shah's research, particularly around adolescence. So just to begin, we, as Dr. Shah mentioned, we are seeing evidence that suggests that there has been a significant increase in many different types of gender-based violence owing to the secondary impacts of the pandemic and the lockdowns that many countries have been experiencing over the past what is now 15, 16 months. Many of our country offices in Plan have reported increased rates of child early and forced marriage and FGM. And this is data that is anecdotal, although on a kind of a global scale will not be picked up for a while. And so we also are seeing the kind of exacerbation of previous inequalities owing to the lockdown and the secondary impacts. For example, refugee and migrant girls and young women who were surveyed by UNHCR in Bangladesh stated that it had become more unsafe for women and girls inside the house since the onset of the COVID-19 crisis. And another example of this would be in Latin America, where Plan and other civil society organizations already did a lot to prevent and respond to the very high rates of sexual violence and femicide, are seeing increased rates of that, specifically sexual violence against children as well, given that many schools in Latin America have not been open for over a year now, and children and young people are, as Tracy mentioned now, have been stuck inside the house for a very prolonged period of time. And so what are we kind of hearing from girls and young women themselves? These quotes are taken from some of the research that Plan has done over the past year across all 4 of our regions, speaking to girls and young women about the impacts that the lockdown has had on them, how they're feeling about it, what they want to see from policymakers, and what they feel as if the longer term impacts will be on their life. And just before I kind of speak through some of these quotes, the overarching message that we hear from girls is that gender-based violence is the most important issue that they want Plan and policymakers to address, as well as obviously other organizations. They feel the impacts of GBV in every single area of their life. They say that it affects their relationships, their education, their health and well-being. And they also experience violence in every aspect of their life, in their homes, their communities, in their schools, and in public spaces. And that is the main thing that they feel is a barrier to their rights. And this came through really strongly in the consultations that we have done across these reports since the COVID pandemic. For example, if we look on the right, Nohelia in Ecuador told us that we're always told that the house was the safe place, but danger and insecurities are something that repeats on the street and in the house. In Vietnam, a young woman activist told us that she knows many girls who have gotten married during the pandemic, and that although she knows that education offers that as a brighter future, due to the COVID pandemic, many girls are giving up their learning opportunities for marriage to alleviate the new economic hardship. And this very much feeds into the message that we were hearing from Dr. Shah as well. We have heard through a lot of our research that the causes and drivers of GBV, according to girls themselves and their families, is in many cases as a result of the economic pressures as well as the closure of schools, because this has resulted in families kind of lacking obviously social security, lacking income. Girls are now experiencing higher rates of sexual exploitation or child marriage or early pregnancy because they have been at home for prolonged periods of time. And this then in turn means that they are less likely to re-enter school, which we know girls that are able to stay in education for longer are less likely to get pregnant earlier and get married. And again, girls have told us that they recognise the increased risk of GBV as a result of economic pressures on families, as well as the inability to escape violent domestic situations. For example, families that were already abusive, children and young people that are experiencing violence in the home, they are less likely to be able to escape that abuse. And the pronounced lack of access to justice against the perpetrator. And this also applies for all services that prevent and respond to violence. We are really seeing and hearing that there are now significant barriers owing firstly to the lockdown and now to, as I mentioned, secondary impacts of the pandemic, that girls and women cannot access or are having serious challenges in accessing life-saving and vital services. And girls were really calling on policymakers and decision makers to ensure that these services were seen as essential and that they were able to continue and that were funded during the pandemic. And lastly, just thinking slightly more longer term about the impacts of the pandemic on girls and young women. So Save the Children have estimated that up to 2.5 million more girls could be at risk of child marriage within the next 5 years, owing to the impacts of the pandemic. And obviously these are projections, but it is very likely that there will be a significant increase in child marriage. And this very much puts at risk the achievement of the Sustainable Development Goals, and means that many girls will face lifelong consequences of this. For 168 million children, school has been closed for an entire year. They haven't been able to access education for a year, apart from virtual education. And a further 214 million have missed 3/4 of their learning. And as I mentioned, this has significant impacts for girls who are trying to, or families that are trying to avoid kind of child marriage. And also we know that schools offer a safe space for girls to report violence as well. And lastly, as I mentioned, the impacts of the pandemic and social isolation measures has created significant barriers for girls and women accessing services. And so we are seeing disproportionate impacts on women and girls because of the economic downturns, and in general, kind of worsening existing gender inequalities.
Thank you, Joanna. The work is so important, and it's just highlights all the inequities. So, and we know from past critical events that have happened worldwide that when things go south, they go really south for girls and women. Akshara Gandhi has been fighting this fight for a while, but you were able to create some new services over the last year in response to the pandemic. Could you share a little bit about the work that you've been doing?
Joanna, actually, what she says also finds a reflection in India. We had one of the most severest lockdowns in the world. The Prime Minister announced it, and it was 4 years. And as you can see in the photograph on the left of the boy sleeping on the suitcase being pulled by his mother, it became an icon. I have to really emphasize this because it was one of the tragedies of the pandemic. then 40.4 million internal migrant workers trekked home because there was so much of fear, confusion, panic, not knowing whether they will get the disease or not. People wanted to go back home. And there was no way because everything was shut down. And I think that forms the background to what happens later on. That when women were told, or when the general slogan and the advice was given, stay home and stay safe. The pandemic was not only, like migrant workers, but I think that the next big, huge lump, the segment of society that suffered were women. They lost their jobs. And women form 80% of the informal sector in India. So their jobs were impacted as they were hawkers or daily wage earners or domestic help. So they had no income at all. Secondly, the entire family was at home. And what does that mean? As it is that women in India, according to the Time Used studies, work 299 minutes per day, every day, as to men 99 minutes at household chores. So you can imagine the number of tasks that increased with all the members in the house. Money was drying up. People were dipping into their savings. Food consumption went down. In this whole scenario, you have a social customs in which men and boys eat first and women and girls eat later. There's very little left over for women. So the levels of nutrition and energy levels also dipped. But there were no hospitals to take care of you because all the hospitals were looking after COVID cases. Anything to do with other health cases as well as mental health issues were totally ignored. And over and above all this, we have domestic violence. Now, Manisha also mentions the National Commission of Women figures, but that is one organization in Delhi. And it is just a small organization that received. It gives you an idea of the number of calls that were pre-pandemic and post-pandemic. What did Akshara do about it? So the first thing which we did was we joined all the other organizations in doing relief and support work because that's what was needed. But first we looked after the people who were connected with Akshara. So we supported 304 households with cash transfers because the trains were shut down, the buses were shut down. There was no way of moving from one place to the other. There were policemen on the street who didn't allow you to walk. Right? It was really, really bad. So what do you do with that? So we did cash transfers. And later on, when there was a little bit of opening, we gave food kits to people. Women suffered, especially young girls. So we organized groups of young women in their own localities to distribute sanitary napkins because they could not go to shops to buy anything. So 4,200 we distributed in this. Now, just to give you an idea of what we did, these were the 4 things which we took up to address the issue of domestic violence. That is, firstly, a public awareness campaign. Secondly, a resource directory. Third, the launch of a web app. And fourthly, the training of service providers. I'll tell you a little bit about each. Okay, so soon after the release of the National Commission of Women's data on violence, we thought it was best that we started working on these cases because unless women reported them, they were not going to get any relief and they would continue to be beaten up. So the first thing we took was that we asked some of our friends in the film industry to ask celebrities to join in our campaign, which was called Lockdown on Domestic Violence.
During the lockdown, there has been a sharp increase
in the number of domestic violence cases.
To all the men we say,
now is the time to stand up
against this violence.
To all the women we say,
now is the time
to stand up and break your silence.
If you are a witness to domestic violence,
in your home.
Please report.
If you're a witness to domestic violence in your neighborhood,
Report it.
If you're a survivor of domestic violence,
Report it.
report it.
Report it.
Report it.
Let's put a lockdown
On domestic violence, let us put a lockdown.
On domestic violence.
Let's put a lockdown.
on domestic violence.
Let's put a lockdown.
on domestic violence.
So where do women go if even they want to report it? So we teamed with the TIS special cell and worked very hard to get service providers to give us their personal mobile numbers. All of these were compiled into a service directory. But how do the women get hold of this service directory? Is this physical form? It's not going to make much use for them. So we converted the directory into a web app, which could be stored on your mobile phone. We had it launched by the minister, so it would have maximum press coverage and social media coverage. With it, a survivor could locate her own town or district, click on the number, and instantly connect with a service provider. We had 11,000 cases which were received by the special cell just after the launch of the web app. So in the last supplementary activity which we did, we trained about 450 government and non-government service providers in the state of Maharashtra. They were invited to an online refresher course in which we introduced them to the directory, its listing, its methods, and in telecounseling. And now we are following up with a report on how women's groups have reacted to this. So this was what we did, and we hope to continue this work a little bit.
Thank you, Dr. Gandhi. Thank you for your leadership in doing this work. It's been a challenge for everybody worldwide to try to figure out how to provide services and change the way we operate. And these creative solutions are so important. So thank you for your work. Appreciate it. So we've gotten to more than a year out, and things are getting better in many places. Certainly India has been challenged with a whole second wave of lockdowns in the last couple of months. But there is this sense, as people are vaccinated, that we're coming to maybe the end of the pandemic. But it was certainly not the end of the pandemic of violence against women and girls. So I guess part of what I take away from all of this, so what are some of the lessons we've learned?
I think, one thing that you highlighted that's important here that I just want to remind people is that violence against women has been a problem long before COVID, and sort of the COVID lockdowns and the COVID economic crisis and health crisis and all these things really exacerbated the problem. But I think, one of the things, and this came up with the various talks today, reporting is hard. So reporting has always been an issue. I think Dr. Gandhi mentioned that we always worry about underreporting of violence. And I think it's gotten even harder during the pandemic, right? Because if you're stuck at home with your aggressor, how do you call into a hotline or, whoever it is that you're calling into to tell them about what's going on at home? And now, so I think one is thinking about more innovative ways that women can report violence. We've seen, so in the United States, for example, we've seen huge increases in the number of text messages coming in. I heard in India, there was a lot more WhatsApp group reporting happening. And so, and this would be an interesting question for Paul as well, like how do we use technology to improve measurement? Because the problem is without us being able to measure what's going on, it's then very hard to think about like programs and policies that, that we can implement to solve these problems. So I think that's number one. And then the number two thing I would say that, we've really learned at the Global Lab is prior to COVID, we were actually doing some work in Tanzania where we involved young men and boys in interventions. The goals of the interventions were to improve sexual and reproductive health outcomes for the girls in these rural communities that we were working in. But in some of our communities, we also included boys in these interventions. And what was fascinating, what we learned from that is in these communities where we were also working with boys, 1 year later, our girls were reporting decreased experience of intimate partner violence, in their relationships with boys in these communities. And so I think, a big thing as we move this agenda forward, obviously the focus has been on women and girls, but we really need to get boys and young men involved if we want to change some of these social norms around violence in many of these countries that we're working in.
Yeah, you're just preaching to the choir. It's so much of our work in ending domestic violence is and sexual assault. So many of the lessons are directed to girls instead of the perpetrators, which are by and large young men, boys, men. Joanna, why don't you talk to us a little bit about kind of what you've learned and what you think that we should do with the lessons that we've learned to ultimately end intimate partner violence?
I think from an international NGO perspective, what we're really seeing is that since the pandemic, resilience and preparedness is essential in the way that we're currently living. We know that the pandemic has reinforced what we already knew, that disasters and crises, which will only increase in the coming years, women and girls are going to be the most vulnerable when these hit, and they will exacerbate gender inequalities and make it more difficult for women and girls to access essential services. And so I think what COVID has taught us is that, organizations like PLAN, UN agencies and governments, we need to be investing in system strengthening. We need to be ensuring that services that prevent and respond to violence and programs that support girls and boys and families, communities to really target those, the root causes of gender inequality and GBV, that they're funded, that they're accessible, and that they're adaptable, so that if another pandemic hits, COVID continues, or another type of crisis hits, that girls and women still have access to these essential and vital services.
I agree. And I think that, one of the things that governments didn't really think about these issues when they were imposing lockdowns. It was not, there was so much panic around public health that it was forgotten that we already had a public health crisis that was in dire need. Dr. Gandhi, what kind of lessons do you plan to take forward from this horrible year?
And I would like to draw a parallel to what we do when we have natural disasters like cyclones or floods. Every government has developed a standard procedure, which is followed by state agency for the prevention of that natural disaster, for the relief which the natural disaster caused, or for the rehabilitation of the affected people. So why can't we have a standard procedure for the COVID pandemic in the context of domestic violence? Yeah, but in order to do that sort of a standard procedure, which at once kicks into place if a pandemic or a near pandemic comes, we have to have three things which we have to look at in a very different perspective. Firstly, the state will have to see women, trans girls as a special disadvantaged group. Secondly, it will have to recognize that it has its own duty to ensure the rights of women, trans, and girls, to prevent any violation of this right, especially during the pandemic. And thirdly, there has to be a common place for a dialogue between NGOs or social civil society organizations and the state. So a public discourse, a common place for that sort of discourse.
If the pandemic has taught us anything, is that the world is very small, and we shared this virus very quickly, and we share many problems across the world. Each culture and country has maybe some specific challenges, which you just mentioned with India. But I think that there are some solutions that can be implemented worldwide. And one of the things that we've all learned in the last year is the value of technology and allowing us to deal with some of these issues. And so, Paul, why don't we talk about some hopeful ideas of how technology can help propel us out of these issues?
People are so comfortable using WhatsApp or text messages that you don't need a training guide for this, right? So it's become part of our second nature of communication. We probably communicate with each other more through text messages than face-to-face words, especially during the last 18 months or so. So again, as I mentioned earlier, that we believe in that the level of digital tools, if you apply them correctly, shift is possible. We see it every day through data, whether how you collect it, how you fill in the gaps of data collection, use of mobile technology to communicate, to actually capture data in an ethical way. Also to, as Dr. Gandhi said, creating a platform to bring together and build a community of minds. So we need to think differently. We need to think in a more adaptive manner. And if I talk from technology solution development perspective as well, in the last 18 months, we always knew it, but it became more evident that the urgency is at such a high level that we don't have luxury of planning things out and building solutions that take months and years to roll out and develop and mature, right? So we have been using a lot of innovative ways to sometimes duct tape things together, because the need of the hour is to put out the fire, and we'll optimize it when things will calm down. But you need to be quick on your feet and think about agile. And in India, the local name for frugal innovation is called jugaad. And that's the kind of the approach we followed in several contexts, where we needed to come up with a solution because it's an ICU kind of a situation. It's an emergency, right? And we don't have the luxury of getting perfect information. We didn't have the luxury of getting all the needs and requirements before we could build a mobile or web solution kind of thing. You have to sort of be adaptive. You have to experiment a lot. So it's just, I think that's kind of have become the new norm in mind of like, how do you actually apply a solution to a problem? And I think Dr. Gandhi, your slide was perfect example of adaptive thinking. We build a good resource directory, but how do we can't print it. So we had to build a platform, a mobile solution, a web solution kind of thing. And that's the nature of the game that has become. The other part is, and to build on to Dr. Shah's point about the data gaps and things like that, right? So we've been leveraging a lot of artificial intelligence tools and machine learning kind of models. So we could sort of build predictive models, right? We could actually make assumptions, reasonable assumptions, to sort of fill in the data gaps and do scenario planning. And that's the kind of the thing that we need to prepare for, right? So how could you influence policymakers, and how can you sort of prepare for that, just like we prepare for, let's say, a weather emergency or a cyclone. If you want to prepare for the next wave of any pandemic, it could be, health crisis, it could be climate crisis. We are going to have these waves of disruptions in our day-to-day life. And so, these things could be planned in a computer simulation. We have tools now that we can actually land a machine on a planet millions of miles away with a few inches of accuracy. It's all based on not knowing the perfect information, going into an unknown terrain, but making intelligent decisions by learning from simulations, by learning from what's the most statistically possible things, and if this happens, then what happens? Because Otherwise, we'll always be making suboptimal decisions that, now, right now, we don't want infection cases to go up. And so let's lock it down without thinking it through. There will be unintended consequences, right? So this whack-a-mole strategy is no longer going to cut it. So we need to think more system-wide and more holistically at this challenge as well. I think Voices for Change, to sum it up, is our attempt in that direction. It is a digital platform to bring together resources, bring together experts, research, activists, organizations like all of you on this call today, to have that place to dialogue, to collaborate, and to build solutions together. How do you create light? How do you create hope? And find those stories which could inspire somebody who's maybe looking for a way out. Sharing a survivor story in a meaningful way. Use your social media to raise awareness and bring people in that these voices need amplification. This is not a taboo, and this is an important topic to talk about. This is not okay.
We've all looked at gender-based violence and work in this space in different ways. And that's really what it's going to take to end gender-based violence. And there are so many levels across all societies, all cultures, that have to be addressed. And certainly awareness is the first step. And creating that, through that awareness, creating just a lack of, that we no longer accept it. We're no longer going to turn our eyes away from it. We're no longer going to say that's not my problem, it's somebody else's problem. It's everybody's problem. 1 in 3 women worldwide, and and we know that the 28% in the United States were on the low side, but 28% of women are physically abused in the United States. Is that okay? Are we allowed to turn our eyes away from that because we're on the low end as opposed to 60% in another country? It's some point we have to say enough. It's not okay. And I just keep beating that drum until people listen. And so I just want to say thank you to all of you for the work that you're doing. It's been incredible sharing this stage with you all, and hearing how the work is continuing around the globe in the midst of a pandemic, and that there are lessons to be learned and work to continue to do. So I'm very grateful for your participation. I'm also very grateful to everybody who is watching this webinar, because that awareness that you're going to share with other people is part of the solution.
How could you see it coming? From 1,000 miles away.